When I started nursing in 1975, as I say, I was involved with the staff nurse division, as it was in those days, and the association was the body, the main body of which the staff nurse divisions were the subordinates. And there was a feeling gradually growing among nurses that this body was not doing its job for nurses. Its job was to negotiate collective agreements that one would expect would improve as time went on. And the individuals who were involved with that at the higher levels of collective bargaining seemed to think that actually talking about money and nursing and putting the two together was something of a rather dirty prospect, and declined to push forward. And one of the key figures in all of this questioning was an individual by the name of Bob Donoghue, who was assistant to the director of collective bargaining. Bob was a Métis, and it's one person's opinion, and I endorse it, that Bob saw in nurses in Alberta a group of people who were being oppressed in the same way as his own people had been oppressed, and felt at one with that. So Bob traveled around the province quite a bit, visiting the various staff nurse divisions, and he implanted in people the idea that maybe we should be questioning what was happening. And when we asked the question of ourselves, we got the answer, well, we're not being represented very well. And perhaps what we need to do is seize control of the operation and ensure that it fulfilled the goal for which it was established. This was nurses breaking out of a shell and saying, we are the professionals that know what nursing is, and our interest is good patient care, so we should have a say in it. And the Professional Responsibility Committee and all of the improvements on that particular clause of the collective agreement were beneficial for patients and for nurses as well, satisfaction, that they are able to have a say. Isn't that what unionism is all about? That if you never know when you're going to need the help of other individual locals and unions, and really United Nurses is part of a much bigger movement, which is the labour movement, and the fact that United Nurses at that time wasn't part of the House of Labour by being in the Federation or whatever didn't make any difference to other unions. They could see that there was a struggle going on with the authorities, whether it was a company or an outfit fronting for the government, that it was all the same struggle. And so the help to deal with those fines came through in a flood.